Welcome to Section 9, Managing Anaphylaxis.
An allergic reaction can become life-threatening in minutes, and waiting too long to give adrenaline can be the moment everything turns. Watch for trouble breathing, wheezing, a cough that won't settle, a hoarse voice, swelling in the throat or tongue, collapse, or a child who suddenly looks pale or goes floppy. And don't wait for a rash. Anaphylaxis can happen without skin symptoms, after food, an insect sting, medicine, or contact with latex. Give the prescribed adrenaline injector straight away into the outer middle of the thigh. It can be given through a single layer of clothing, so don't waste time undressing them. These injectors are made for non-medical use, with one fixed dose, and they work fast to reduce airway swelling and help blood pressure recover. If there's no improvement after 5 minutes, give a second dose if one is available. Here's an easy way to remember how to use an adrenaline auto-injector. Blue to the sky, yellow to the thigh. The blue safety cap is removed first and always points towards the sky. The yellow or orange end containing the needle is placed firmly against the outer mid-thigh. Simply remember, blue to the sky, yellow to the thigh. This simple phrase is widely used by first aid trainers and can help you remember the correct orientation during an emergency when every second counts. Position the child correctly while waiting for emergency services. Lay the child flat and keep them as still as possible. Do not allow them to stand, walk, or suddenly sit up, even if they begin to feel better, as this may cause a rapid drop in blood pressure. If the child is having difficulty breathing, they may sit with their legs extended in front of them. If the child becomes unconscious but is breathing normally, carefully place them into the recovery position while maintaining an open airway. If the casualty is a pregnant woman, position them on their left side. This helps improve blood flow and reduces pressure on major blood vessels while waiting for emergency medical assistance. Stay with the child and keep them as still as you can while help is on the way. This is the moment to watch them closely and keep their body settled. Reassurance helps, but your main job now is observation and positioning. Don't encourage movement and don't wait to see if it passes. Call 0000 right after giving adrenaline and say clearly that the child is having anaphylaxis. If the child becomes unresponsive or isn't breathing normally, start CPR straight away and keep following the ambulance operator's instructions. Even if they seem to recover, transfer to hospital as standard, with at least 4 hours of observation after treatment. Keep watching their breathing, airway, level of consciousness, and whether the adrenaline is actually helping. This needs continuous checking, not a quick glance and wait. If symptoms are still there, or they improve and then return, another dose of adrenaline may be needed after 5 minutes. Be ready for that next decision. You'll be judged on the full response, not just the injection. That means recognizing anaphylaxis, positioning the child safely, giving adrenaline correctly, calling emergency services, and monitoring them closely. The errors that cost safety are usually simple ones. Leaving the child alone, waiting too long to give adrenaline, or letting them stand can all make the situation more dangerous, fast. The big misses are usually simple. Putting the injector in the wrong place, waiting to see if symptoms settle, or forgetting to call an ambulance can all burn the minutes that matter most. If you're not sure, don't hold back. Give the prescribed adrenaline injector, then call for help immediately. When every minute matters, remember the sequence. Recognize anaphylaxis, lay them flat, give adrenaline, call 000, and keep monitoring until the ambulance team takes over. That's how you protect the airway, protect circulation, and buy the child the time they need.